Hello, this is Dr.Das. I'm a dietitian from Apollo Hospital and working in Dar es Salaam. Well, we are going to talk about diabetes. There are people who need to know what exactly diabetes is and how can we control. There are very many myths are around and people they believe them, they try them. But end of the day when they come to a doctor, it's been delayed already, they get organ damage and it become complicated and it's very difficult to control the diabetes by then. If you are diagnosed with a diabetes and your sugar levels are not that high, you can try to control with your diet and regularly keep a monitor that how your sugars are fluctuating. Some patients they come to our clinic and they says, "Doctor, our sugar is controlled." When I ask them, "How do you know? What do you do to know that your sugar is well controlled?" And they say, "When I wake up in morning and I check, my sugar is 5.5. But this is not just checking the sugar and you finding in between the ranges. That is not sugar control. Every person is different and so their sugar fluctuations. Sometimes it may be well controlled in the morning, but it could fluctuate in the afternoon, maybe at night, but you will never know. So how to know if you have a proper control in your sugar or not? There is a test called HbA1c, or also known as glycosylated hemoglobin. It gives you past 3 months sugar, and even you are taking some medicine, it might show these medications are working or not. For Asians, it should not cross more than 6.5. If it is more than 6.5, that means your sugar is not well controlled and it need to be controlled as soon as possible. Otherwise, the complication may arise very soon, which involve the eyes, the vision reduced. You can get a cardiomyopathy when the heart enlarges. You get swelling in the legs or sometimes difficulty in breathing. Sometimes brain, you starting forgetting things, your memory reduces. You get nerve problem, numbness, tingling sensation, burning pain in your legs and hand. And kidneys. Most of the patient, they try many things before coming to a proper dietitian and they end up having a kidney damage, and once the kidneys are damaged, it's very rare that they go back to normal. So I advise you, whenever you are having diabetes, try to see a proper dietitian as soon as possible so you can live a healthy and happy life. Once your body organs are damaged, you started getting more problems. Then it's not only about controlling the diabetes, then you have to also control those problems. Like if you get a cardiac problem, now you have to take medicine to control the heart, then you will not be able to also live a normal life, because anything you do, you get tired very fast. So you should take care of your diabetes as soon as possible and should not let the diabetes cause problem in your life. So what is diabetes? Diabetes is a metabolic disorder. Every person has something called pancreas gland which produce insulin. Now whenever you eat something It doesn't have to be only sugar, anything you eat. Your glucose level, that is the simplest molecule of your food, it started increasing. Now what insulin do, it combine with those sugar molecule and turn into energy and get absorbed by the muscles or by the body. Now imagine you do not have insulin. Then the sugar level increase in your body, and once the sugar level increase, there's lots of complications starts. Now there are two types of diabetes. You must know what type of diabetic you are. There are type 1 diabetic, those who do not produce insulin at all since birth. So they are basically on injection because there is no insulin at all. And type 2, which is you have insulin but they are abnormal, they are not working, the pancreas is not working. So you take tablets, and those tablets actually help those insulin to work, and it's also force the pancreas to produce more insulin to control the sugar. Now there are cases when patients do not take care of the diabetes. They eat whatever they want, they do not take medicine on time. If you do so, your pancreas get damaged. With time it start reducing working, and then those patients end up taking injection because the production of insulin reduced. Now you must take care of that. Now let's talk about what kind of food you should have if you are diabetic. If you go to some hospital, some doctor will make you a chart about how much milligram, how much gram you're supposed to eat, what you're supposed to eat, what time. I see it's very complicated because everybody loves certain kind of food, and it is very difficult to also measure and eat every time. So basically diabetes doesn't require any kind of chart. It's just in moderation you have to eat. Now in the food chart there are certain things you should eat, and there are certain food you should rarely eat. In rarely foods, you should not have chocolates, ice cream, soda, any sugary food which has direct sugars. Some doctor will tell you should not have rice, potatoes. Well, that's not correct. We gain our energy from carbohydrate. If you stop completely, it will reduce your sugar definitely, but it will also start eating your muscles, because whatever you do activity, it required energy, and because you are not providing any carbohydrate, it started burning the lipid, and it also start burning your protein. So what happened? Your muscles, hand, legs become very, very thin. The buttocks become very thin, and you start losing weight. So you should not do that. In the afternoon, you should have one bowl of rice, small, like a small bowl, not a big one. A half potato is okay, but you should not eat rice or potato at night. Why not? Because if you eat that, because you do not do anything at night, and it turns into a cholesterol or fat, and it actually give you more weight gain. You should avoid that. In food rules, white flour you should not be using. There are 4 fruits you should avoid: mango, pineapple, dates, and banana. It is not that you should not eat at all, or you are forbidden some kind of thing like that. No, you should have those, but once in a while, not everyday basis. Others, everything you can have. Now when you go to a supermarket, you see there are fruit juices written no sugar added and natural juice. Or soda, it's zero, or certain kind of soda is written sugar free. Well, there is no sugar free juices or natural fruit. Everything has sugar added, so should avoid them. If you want to drink juice, bring fruits at home, grind them and drink fresh juice at home. That will be better, except those fruits I told you. You should exercise every day. About the food also, you should eat properly in the morning, and as the day passes, your food amount also should be reducing. You should eat 5 times a day. Being a diabetic, because the sugar fluctuates, you feel hungry all the time, and if you do not eat and skip meals, it actually fluctuates the sugar more. So you should eat minimum 5 times a day. That doesn't mean you have to eat a lot. You can have a little food so that you don't feel like hungry. Should eat like 8 o'clock in the morning, and you make another after 12 hour, 8 p.m. you can have your dinner. So 8 a.m. in the morning you should have your breakfast, 8 p.m. your dinner. In between 3 times you should eat. In between 1 o'clock you should have your lunch. 11 o'clock you should have something like a fruit, and 4 o'clock you should have a cup of tea or coffee, and that's it. There is nothing like a list or chart you need, which you need to read every day and follow. Now those patients who using insulin, you tend to get cholesterol, because the side effect of insulin is cholesterol or gaining weight. So if you are taking insulin, you should be monitoring and eat properly. Without taking meal, you should not be taking insulin, otherwise the sugar might drop suddenly and it can cause more damage. Little bit high sugar will not cause any problem for it, talking about temporarily. But if you do not eat and inject yourself with insulin, it will drop suddenly and cause hypoglycemia. And hypoglycemia is more dangerous than hyperglycemia. It's a medical emergency. So you should eat every time before taking the insulin. You should check your cholesterol, kidney function every 2 or 3 months. You should have a proper family doctor or dietitian whom you should be going to. And the last thing, those people who drinks alcohol actually reduce your blood sugar. So whenever you are planning to drink alcohol in a party or in a gathering, you should always have foods properly before taking the alcohol. And you also should always reduce your insulin level after taking those kind of dinner, as alcohol itself reduces sugar, and combined with insulin it may drop more. Thank you very much for listening to this audio. I am Dr. Das again. If you have any problem and need any advice, you can always message me or mail me. My email ID is diabeticclinic@outlook.com. You can always find me in Facebook. That is Diabetic Clinic in Dar es